Carrie is here answering your email questions at tips@channel3000.com. How are you?
Hi, good to see you, Carrie.
How's Poppy?
Oh, Poppy is good.
We miss Poppy. We got to get her in here one of these days.
I know. I wish I could bring her in. It's just, she's a different dog in here than she is at home.
She doesn't like the car, too, right?
Exactly.
All right, we have a question from Danielle that our lab is 3 years old, has 3 seizures about 7 months apart. The past week he had 2 in 24 hours. Our vet wants to start him on
Phenobarbital.
There you go. We are concerned that once we start this medication, it'll be for the rest of his life. What are the risks of starting or not starting this treatment?
Well, the risk of not starting the treatment is that the seizures continue, and usually that is the recommendation. If the seizures are happening more than once a week, it is a good idea to think about starting a medication. There definitely, with phenobarbital, as with any medication, there can be side effects, and that's something to talk to the veterinarian about. What are the potential side effects with starting that medication? A lot of dogs tolerate it really well, but not all of them do.
And what's the cause of the seizures? Do we know?
You
It
know,
varies?
Do dogs have epilepsy?
Dogs have epilepsy, and usually that's the most common reason why they have seizures. They can have seizures if they get into like a toxin or something like that, or if they have a brain tumor, that's another reason. But most commonly, once you rule everything else out, epilepsy is what's left, and that's the most common diagnosis.
Yes, that's tough to watch, I suppose, for the family, too.
Oh, it is. It's so hard because it's something, when your dog or your cat is having a seizure, you really can't do anything about it at that moment. You just have to be with them and help to support them until they get through it. And that's why getting on a daily medication, you know, it's not something that we do lightly, but if it prevents those seizures from happening, then that's a good thing.
I have a personal question. First of the month, I always give the dogs their heartworm medication. I use the Simpatico 3-in-1 heartworm. Do you have to do that all year?
It is recommended to give the heartworm and the flea and tick preventatives all year round, and for a couple of reasons. Just for consistency, so that you know once a month, like on the first of the month, your pet is going to get their preventative, and you don't have to think about skipping a month and trying to restart it again. Of course, if you stop heartworm preventative for a month or a couple of months, you always want to do the heartworm test again, just to make sure that nothing got through. And you know, with the weather, the warm fluctuations, even in the middle of winter, anything can start to become active again. The mosquitoes can come out. The ticks certainly can become active if the temperatures go up a little bit. And fleas can live inside. You know, so it is a good idea to do those preventatives once a month. If I had to choose one, I would say heartworm is the most important. If you took a month off of the flea and tick for January, February, that's okay. If it's ice cold out there, that's okay.
I do the all-in-one.
But you do the all-in-one, it's convenient, and then you're covering all your bases once a month.
Carrie, thanks for coming out today.
Good to see you, Carrie.
Thanks for the question.
Too.
We'll see you next month.
Okay, sounds